welcome to News Mobile Big Question. I am Saurabh Shukla, and today I'm joined by a special guest from Washington, D.C., live from the White House, Dr. Rahul Gupta, who's President Joe Biden's key advisor and director of the drug control policy in his administration. Welcome to News Mobile, Dr. Gupta.
Thank you for having me.
Dr. Gupta, let's set the ball rolling. President Biden announced his unity agenda and overdose epidemic, as he mentioned about it, was a key essential of that. How far have we reached in tackling it in the last, since we are in 2024 now?
Well, when between 2019 and 2021, we had double-digit rises in overdose deaths across America. And President Biden has made it a top priority as a part of the unity agenda to make sure that we're doing everything possible to curtail that. Unity agenda basically means that he understands that this is a problem that affects everyone across populations, across socioeconomic status, rural, urban, no matter where you are, every family, community, school systems, and others have been impacted by this. It affects businesses, it affects national security, and it's become a global problem since. So with that vision and understanding is why the president put together a unity agenda. And where we are is we're working to flatten the overdose death. Right now, we've had significant amount of success in the last 2 years. And the president certainly looks at this as doubling down in 24 to make sure we have the full impact.
Dr. Gupta, you were instrumental, and I recall, when President Biden met President Xi of China, one of the key issues that the United States took was the fentanyl crisis, which is sweeping through communities and has been a great concern for this administration. How much of a progress have you made on that to curb the, entry of fentanyl and to make sure that you can ensure that the United States and some of its territories are safe from fentanyl so that the young people, their lives can be saved?
Well, President Biden has been very clear that we're going to work with our partners and allies across the globe, like India, like Mexico, Colombia, and other like-minded nations. But at the same time, we are also going to work with the People's Republic of China to make sure that we're highlighting for them how to hold these chemical shippers accountable that are shipping those chemicals into Mexico for production of this deadly drug called fentanyl. And this is because of that, the president, when he met with President Xi of the PRC, he was very clear that we must resume our cooperation on this counter-narcotics effort. And since then, we're moving forward, but it does not go unnoticed that leadership at a global level is critical, it's necessary, and it's exactly why the president has been so forward-leaning, primarily because young people across America and across the globe deserve our attention to make sure when we're looking at counterfeit pills that often have, or fake pills that often have fentanyl in it, they may be disguised as some of these Xanax or Adderall or some of the other pills. They're being aware of that, and they're doing what they can to carry the antidote with them to save more lives.
You are the first medical doctor to occupy this position. Just a piece of advice for our viewers here. How does, and I speak to a lot of educators, parents who are concerned, how do they recognize, is there a way you can detect fentanyl easily? How does one go about doing that?
Well, I'll tell you, first of all, we often talk about that because as I travel the country and the world, I meet with families who have lost a loved one, oftentimes young loved ones, too early. Parents are not supposed to be burying their children. Unfortunately, that's a fact today. And sometimes they're not even aware of it. So I always advise, not only as a physician, but also as a parent, that you can do two things. First, have a proactive conversation with your children that if they are having a reach out from anyone, from social media to in school, about these pills, which may look like real pills, but they may be actually fentanyl pills, and make sure you caution them about that, proactive conversations. Secondly, it's critical to monitor the mental health of your child or your loved one, to make sure that if the adolescents are having a change in their academic performance or some elements of social isolation or other aspects, talk about it at dinner table. Make sure that they're feeling listened to and heard, and recommend that they seek out help and connect with you, as opposed to going online and ordering what they think is going to help them, but may end up being their last pill. And we lose young people especially, but Americans unnecessarily.
Is your office providing any kits to communities, schools to detect this? Because obviously, one of the things that I've heard is often this is laced and mixed with other substances, and often people fail to detect it.
Yeah, so, the president has made it a priority for the first time in the federal government's history to include harm reduction policies and fund those, meaning having drug test strips available to communities and be funded for that, as well as naloxone, which is the antidote, and syringe service programs. The reason that is important is exactly what you have said, which is that oftentimes people are not even aware the deadly dose of fentanyl is in what they think is safe drug supply. So it's really important for people to be able to check for that. And those drug test strips are available. Unprecedented funding that is going on to states and communities, larger than the entire previous administration, and it's larger than any of the last several administrations. But the idea here, the president feels strongly, is to get people the help as they need it, to be able to not just survive, but thrive. And that's the important part.
What is the priority for your office in 2024? What is the mandate that President Biden has given you to complete this year?
Well, we must work to do everything we can to save lives. Now, that includes making sure that we are prioritizing this drug called naloxone, which is a life-saving medication for someone that is going through an overdose from opioids. It is now available in this administration over the counter in pharmacies. It is also widely supplied through the funding available from the federal government to states and communities. And then secondly, work on disrupting the fentanyl trade, the entire global supply chain, going after not just the traffickers, but also the financiers and the money angle. And more importantly, even focus on prevention, getting treatment out there to help Americans and make sure that people have a fair chance at recovery. Recovery is a lot more than just treatment. It's about housing, it's about transportation, educational opportunities. Because the fact is, I mentioned, so many communities across America today are being impacted, and it doesn't care how you look like, where you live, and what your salary is. It just doesn't care about that.
Dr. Gupta, you had a very successful visit to India recently, and you are a Delhi boy. Delhi to DC has been a remarkable journey. A lot of our viewers, readers, they are interested. How did this transition happen? How long was, and what is your advice for a lot of students who are here to realize their American dream? What is your piece of advice? How do they be successful and try to reach a position like what you have done?
Well, thank you for that question. This was not in the planning for me. I was an average child going through education, was fortunate enough to be able to enter medical school. In fact, I went back to my medical college this time around, University College of Medical Sciences in Delhi, and had a great reception of all the great professors and leaders that are there working and doing excellent work to save lives every day. But the important piece here is, to follow your dreams, to follow your strengths, and to be able to have real impact in whatever you do, wherever you are. That's an important piece. So passion is important. This time around, when I was in Delhi, I've previously traveled to a number of states, Punjab, Jammu and Kashmir, Karnataka, Uttar Pradesh. A part of that travel is to see and experience the challenges that our communities face across the globe. But I was able to meet with various ministries like pharmaceuticals, like social justice and empowerment, the health ministry, and be able to have that conversation about why it's so important to make sure that we're doing everything together for prevention, but also treatment and intervention.
Dr. Gupta, collaboration with India is very important for the priorities that you have set out. How Prime Minister Modi had an excellent visit to United States. Tell me what can India and the United States do more to curb these illegal drugs coming into this country, and also to stop the syndicates from utilizing some of these countries?
Well, it was really a historic visit that Prime Minister Modi had, and we were really, excited to host him. And obviously, President Biden, puts a lot of credit into the relationship, and it's important that strong relationship between some of the largest democracies across the globe at a time when it is so difficult with so much of turmoil across the world. So I think this is where we find hope, we find vision, we find optimism, the ability of these two large democratic institutions to work with together to solve the world's problems. Becomes important because the problem of illicit synthetic drugs, as unlike heroin or marijuana or hashish or others, the synthetic drugs is really a scourge that is expanding very rapidly across the globe. Today, you can divide up the entire world into the countries that have this problem, that know about it, like United States. Countries that have this problem don't yet know about it, and those countries who are going to have this problem. India and the United States understand that very clearly and are leading on the efforts to make sure that more of the world population understands it and takes clear steps to prevent this problem for killing and harming more of their citizens and residents.
Dr. Gupta, we spoke about your India trip, and obviously there was you mentioned about a sense of nostalgia. What is the difference that you saw in India? It's a new India. A lot of developments have happened on infrastructure, on key issues like even health, digitization. In fact, during COVID, we saw that even the vaccine certificate that was there in India was all digital. So what was your impression when you went to India during your last trip?
Well, first of all, as you mentioned, the infrastructure investments have been never like before. The advancement of technological breakthroughs and adaptation of technology, including that in healthcare, has been remarkable and a model for the world. We see, as we travel, a robust India poised to grow and poised to make its mark. It is really important to work together in these areas, because whether it's space, whether it's infrastructure, workforce, whether it's education, economic changes that are happening, these are really important components of the progress to highlight that the country, as a country, India is making with not only its large cities but also the rural population. This is the real reason that I traveled to both the outskirts of states like Punjab, Jammu Kashmir, but also within major metro cities. I think it's remarkable. It's optimistically, heralding an era where this will be good for the world, for two countries to work together to solve the toughest problems that we face across the world, whether it's simple things like clean water or tough things like the pandemic, as well as the global challenge of synthetic drugs.
Dr. Rahul Gupta, thank you so much for talking to News Mobile. It has been a pleasure to have you here today, sir.
Thank you for having me. Appreciate you. Happy New Year.